Welcome to Rubin On Point, a podcast about cancer, resilience, and being human. I'm Dr. Dan Rubin, and together we'll uncover the true power of resilience, the strength to recover, adapt, and thrive through life's toughest challenges. Each episode will bring bold ideas, transformative practices, and inspiring stories that redefine what health, healing, and what the human spirit can achieve. And you're going to meet some really cool people along the way. If you're ready to turn obstacles into opportunities and live with greater purpose and courage, you're in the right place. Let's get started. Your journey to resilience begins now. Welcome to Rubin On Point. I'm Dr. Dan Rubin, your host, and you know this podcast is about cancer, it's about resilience, and most of all, and above everything, it's about being human. And today I have the opportunity to sit down with my good friend and colleague, Dr. Rafael Gonzalez, who is Chief Development and Science Officer at ReStem, which is in California.
Yes,
Dr.
correct.
Gonzalez. And Dr. Gonzalez and I work together in the field of tumor immunology. He also works in the field of stem cells and regenerative medicine, one of the absolute top names in the field. Let's go. Let's chat. What do you want to talk about first?
I think, how did we, we connected through Dr. Matt Halpert.
Yep.
Is the way we met.
I'm so thankful for that.
Yeah. And are fortunate to have a lot of common colleagues, a lot of common individuals. For those that have opportunity to actually work with Dr. Dan Rubin, all the time I'm telling you, praising all his work, everything he does, because there's a full integrative, oncology center where you're talking about. A lot of people don't do that. It's either they go complete, natural, or they go traditional med, and you do the combo. Yeah, you've put both of them together really, really well.
Thank you. From the beginning, that was the goal.
Yeah,
is we thought that on the whole, for people in the world, that would be best for them. There's less cost involved, higher efficacy, better throughput, better research and science, because in our world of naturopathic oncology, it's difficult to kill cancer cells. But in the world of conventional oncology, the support, the science that we have, how we view the body, the lab testing we do, the diagnostics, it's just not there. And so the worlds blend together so well.
Yeah. I agree. We commonly have dealt with a lot of individuals, of course, with cancer, and fortunate to work with you in the in the context of Immunocine, which, for those that don't know much about Immunocine, I'm sure they've heard it before. Mm-hmm. The dendritic cell vaccine. The word vaccine has that
negative connotation.
Yeah. And but this is not the case, because this is a true vaccine.
Like,
There's
what
no
does
preservatives.
Vaccine actually mean? Let's put it out there for people.
Yeah.
You're a PhD.
Yep.
You're a doctor. You're not a physician, but you're a researcher. You're a scientist. Yep. So, scientifically speaking, what does vaccine mean?
It's basically something that is produced to specifically have a target.
Okay.
A target to stimulate an immune response towards something.
Very specific, though.
Very specific, correct. Yes. So, for instance, we think of the vaccines, for instance, like a chickenpox vaccine. It's designed basically to target and kill the virus, or target and stop the virus from
So you
doing
take a
anything.
little part of the virus, like a messenger part of the virus, you inject it into the person.
Yep.
That creates an immune response to that particular part of the virus, and the immune system reads that message and then is armed and ready.
It's armed and ready, and the concept behind it is more the surveillance aspect of it.
Oh, okay.
Once it's basically been armed and ready, now you have a specific cell type, a regulatory T cell, that can basically, surveil the immune system, and if it tries to come back in, it forms an immediate target destruction.
Thou shall not pass.
Of it. Correct. Yeah. It's like the Monopoly board.
Can't
that's
pass
it.
go.
Can't pass go.
Got it.
And that's about it. And it stops it there. The problem with vaccines nowadays is there's so much modifications and adjuvants that they've actually put in them.
What's an adjuvant?
It's basically something else that you add to it to help, the process, or to help it do something better.
Just like make it be a little bit more stronger, the immune response?
Yeah, correct. Or basically to preserve it. Okay. To make it, to preserve it more than anything else in the context of vaccines now. And then also, additives on there that can be problematic to many people. And that's one of the biggest problems that is out there now with the negative behind it. And
Yeah.
it's bad because some people are getting sick with doing specific ones, getting too many
Yeah.
vaccines.
At once, and it's a lot of neuroinflammation, and maybe the messages are getting crossed and the body starts short-circuiting immunologically because they're like, wait, what do we do with all this information? The immune system wasn't developed, however anybody believes spiritually, religiously that our immune system developed, it probably wasn't developed to receive that many messages at that young of an age all at once.
Oh, I agree 1,000%. That's one, because of course the immune system's not developed until you're about 18 years of age or a little bit less than that.
It's hyperactive.
Yeah, it's ready to go. That's why as a kid you're consistently sick.
Yeah.
Up until you're 6, 7, 8, 9, you're still developing quite a bit. But there's something that a lot of people don't talk about and understand. And if you think the logic behind this, it makes complete sense. There was someone that back in early 2000s discussed this thing called Asia, which is basically a autoimmune, basically direct target to sort of an antigen. And the concept behind it was when you take a vaccine or when you take something and you put it in the immune system to target, let's just say hypothetically what we just talked about, chickenpox. What ends up happening in a lot of individuals, and we don't know why, and these individuals get sick, the immune system then only focuses on that one thing.
Okay.
This then causes havoc because your body is consistently basically hit with all these different
A lot
pathogens.
of info coming in.
Yeah, it's too much stuff going on. Other viruses, bacteria,
So they have to sort
mold
through it?
exposures. It doesn't have the capacity to remove the other stuff because it's so focused and so targeted towards that particular one thing. And it's funny because when the first publication on this came out, this guy was sort of laughed out, and now it's a proven theory.
That's like the theory of angiogenesis in tumors, like Judah Folkman was like shunned for decades.
Yep. Yeah.
Now there's medicines like that. Let's go back to our roots. You also work with a company or have a company called ReHealth.
Correct.
In Cancun, and you have I think it's an ISO 6 CGMP certified lab.
Correct. Yes.
And you have a clinic there. You have doctors in Cancun, and you're doing regenerative medicine.
Yeah.
And because of you having that lab there, and because of Matt Halpert, the CEO of Immunocine, who was looking for a lab several years ago, ran into you. Immunocine partnered with ReHealth, and Immunocine exists in Cancun, shares the lab.
Yep.
And those Immunocine dendritic cell therapies, I guess instead of Immunocine dendritic cell vaccines, are produced in the same lab where your
correct. The
cells
manufacturing is done there.
Yeah.
Correct.
And that's how you and I met, is because
That's how we met.
I had a patient who wanted me to vet Immunocine for her because she knew my deep roots in dendritic cell therapy, dating back to the 90s. And knew that my first love in oncology was not just the philosophy of oncology, not the diagnostic part, but also the immunological part, and that the immune system is your first and last defense. And that's how I got on board with Immunocine, and I'm incredibly fortunate to have met you. I'm going to say it here in public. I thank you for teaching me what you have, trusting in our services and our know-how and us as physicians, and it's been great to work with you.
Likewise. It's, what people don't understand is people get confused with what is a dendritic cell, because it's not talked about that much. And what they don't understand is that this particular cell in your immune system is part of like the immediate response, what's called the innate response. And it is basically in charge of dictating everything in the immune system. If you think of anything that goes into the body that's supposed to be attacked, destroyed, this is the cell that basically takes it in, chews it up, and then it's pretty crazy how in cell culture you can see, like in a petri dish, you can see what transpires when it becomes activated, because it sort of has a configuration that looks like a closed fist when it's just naturally occurring. But then after it chews up what's called an antigen or something of interest, it then exposes all these different tips and all these different areas that it can expose basically everything that the immune system has to recognize to target and attack. And that's why when done correctly, which is what Immunocine does, and is a big difference in the dendritic cell therapy, the double loading procedure, it now basically gives the entire full signature of a tumor, of your individual tumor, because this is precision cell therapy is what it basically is.
How biology dictates that it's to be done in the first place.
Correct. Yep. The correct method of, if you were young, you didn't have any issues, and your immune system, which is challenged on a daily basis and gets mutations on a daily basis, would basically eliminate this. The body would recognize it and eliminate it.
It's a big responsibility the dendritic cell has.
Yep.
So it gives the marching orders to the rest of the immune system. Once it gathers the appropriate information, sifts through it, and then I like to say it kind of gives a PowerPoint presentation to the rest of the immune system, specifically T cells, and says, go kill this.
Yep. Yeah, the T cells basically are the ones that build that infantry, which basically can now, go target and, produce a bunch of clones. Okay, go get this, target this, and kill it. The two analogies, it's the general of the army and it's the conductor of the orchestra.
Ooh, I like both those.
Yeah, both of those are the correct terminology for this.
Think about that. Like, it's almost dichotomous, the responsibilities. It's almost like, all right, in one part of my life, I'm this, aggressive general of the army giving these orders to these soldiers. And on the other, I'm the maestro of the harmony of the immune system.
Yep. Yeah. That's actually good to think about it that way. I just look at it as it's in charge of, dictate, but it has to do it the correct way, which is
Or else it doesn't work.
Yeah.
And that's where the failure over the last 30 or 40 years has been in dendritic cell therapy, and probably why people don't know that cell as well.
Yeah.
I mean, it's when people give like immune stimulating therapies, and it's much more understandable if you give like a peptide, like thymulin or thymosin for the T cells, or people understand like, oh, this boosts natural killer cells. But you're right, people don't understand what a dendritic cell is.
Yeah.
And it's really important. I mean, I think about people who have primary melanoma of the skin. And dendritic cells make up a large portion of the real estate of the skin.
Yeah.
And the melanocytes, those are the cells that become melanomatous. They're sitting right there next to this very important immune cell.
Yeah.
But sometimes they're silenced, or there's just something disrupted in that immune continuum, and those melanomas are allowed to grow. But it's interesting that once you get the appropriate tumor information into a dendritic cell from a melanoma cell, that therapy can work beautifully well.
Correct, especially the way they actually do it, which is, isolating what's called the lysate, which is basically the proteins that are in that particular tumor, and then also a specific method of capturing the DNA. So you're actually getting the full signature of your specific tumor, which is what makes it neat, that makes it a direct target to it. But let's talk about why, we're here, and the preserve, which is...
so I was just going to ask you, you just talked about the lysate and the DNA. So how do you get that into the dendritic cell? Where does it come from?
So it comes from an individual's tumor. So for this to work, you have to have a tumor that's biopsiable. And it has to be a tumor, of course, that is, mutated, has cancer there. So you can actually take it out. And it's a small biopsy, which biopsies are done regularly on a regular basis if you have any form of something unusual in the body.
Yeah.
And taken out, and then from there we put in a specific solution, and then from there go through the process of isolating that protein and the DNA.
And some people, when they apply to Immunocine, they learn about it and they're like, hey, I want to go through this treatment, but they might not have any tumor in their body, so they don't have an opportunity to get that thing. Or they might have something that's isolated or difficult to get to, or it's risky to get to, and they sometimes don't have the opportunity for that, quote, tissue harvest.
Yeah.
Which is why Immunocine Preserve exists.
Yeah, which is basically preserve the tissue. And the other reason is, too, if you think of, many people just want to go traditional, and that's perfectly fine. But give yourself the opportunity of, if you have a tumor, they're going to do a biopsy. Let's capture that biopsy, send it to Immunocine Preserve, and if things don't work out with traditional, then you can come back and we have that signature of that tumor, and then it's preserved there, it's waiting there. We can then discuss the Immunocine, the cell therapy, the dendritic cell therapy.
There's no reason to think that this type of Immunocine dendritic cell therapy, or just dendritic cell therapy, isn't conventional. It's not really alternative. I mean, it's in clinical trial.
Correct.
It has been for years. It's how the body works. It's not like a weird thing.
Yeah.
It's just not the norm mainstream because it's not a small biological. It's not radiation, chemotherapy, surgery. But it's natural biology. It's not manufactured different than what we find in the body.
Yeah. Yeah.
Another thing about Preserve is some people, let's take somebody with ovarian carcinoma. They're diagnosed, they get biopsied, and sometimes at that biopsy, it's a fine needle aspirate, it's not a lot of tissue, or they don't know that it's cancer yet. So people aren't necessarily capturing tumor. They don't find out about Immunocine or any immunotherapy. So they go through maybe 3 cycles of chemotherapy and they have a good response. And now it's time for surgery. And at surgical time, because chances are that tumor is not all the way killed from the chemotherapy, at that surgery time, that's a great time to harvest tumor and to send it to Immunocine Preserve.
Yeah.
And then they go through 3 more cycles of chemotherapy and then decide, like, hey, do we want to use an immunotherapy to clean up any microscopic disease that is there? Because that's obviously a good time. But that's true. Preserving tumor when you can is important. If you never use it, you never use it.
Yeah.
But think about it. People store their children's stem cells when they're born for potential future use. There's really nothing really different about this.
There is nothing different about it. And it's just a relatively easy, smart approach where a lot of people take it. Well, the other problem, the big problem with, understanding the Preserve is somebody will go get a biopsy somewhere. They'll say, oh, I got a biopsy already if I have it there. The problem is that when you normally get a biopsy done, the pathologist will take that biopsy and put it in a specific fixative. It'll be glutaraldehyde, paraformaldehyde to fix it. When you do that, the concept behind it is just so I can slice it and look at the cells and look at the morphology of these cells.
It like immortalizes the cell.
Yeah, it basically just freezes them.
Yeah.
And from there, you can't really isolate good protein, good DNA. That's why the Preserve is a little bit more specific as to, if you got to go get a biopsy done, consider this simultaneously to make sure that whoever's doing that biopsy understands that it needs to go in a specific solution to preserve it the right way, to be able to process it later on. Otherwise, you went through a procedure, they put it in paraformaldehyde, we can't use it.
Can't use it.
Yeah.
No, and that's a great point, because a lot of my patients who I recommend it to be like, oh, well, I had surgery before. Can I just use that? And you can't.
Yeah, you can't. Rarely do centers actually do, another correct method is a lot of research centers will take half of it and do the paraformaldehyde to do sectioning, and then they will snap freeze, which means they just put it in liquid nitrogen really quick to freeze it. That way we can, but that's only research centers. I've seen like places like City of Hope do that. NYU does that. It's hard to get tissue, from there. But it's people need to understand this is available out there.
Yeah.
It's an affordable method to actually store something for your future. Even if you think about it, the possibility of technology, the way technology advances on a regular basis, maybe that's something different, version 2 of anything else that can be produced. Yeah. It's a smart approach. It's very similar to what you said earlier. People have babies, they store the cord blood just in case. Yeah. And why not do this if you have the opportunity?
I mean, it's literally a lifeline.
Yeah.
And it's like that cord blood, those stem cells are there if you need it. And you don't ever know if you're going to need it. But it's like insurance. It's good to have it if you need it, better than needing it and not having it, right?
Yep.
And it's actually easy. If somebody wants to go to Immunocine Preserve, the website's immunocinepreserve.com, and they can go there and you can order a kit, and then Immunocine Preserve just sends the kit out and it's there. You bring it to your surgeon.
Yep.
And surgeon, plops some tumor in there and you send it back to the labs in Scottsdale, Arizona.
Yep.
And it's preserved there for a couple of years.
Yeah. And then if you want, and to understand better the dendritic cell therapy, you'd go on to immunocine.com and you'd understand the entire process of why, what, the science behind it, all the work that's been, done behind it. And then you'll understand better of why should you preserve this tissue, which is immunocinepreserve.com, which either one of those two is really, really easy to, what you just said, is go on, register. The great thing about just straight immunocine.com is, people think that you register somewhere, so what? No, when you register on immunocine.com and you have cancer, they will then immediately reach out to you. They will go through basically your diagnosis, what's going on. They will then forward it to, it's a big team. There's a scientist that's part of that team. there's many different doctors, oncologists, interventional radiologists that are part of that team. Just to tell you, even if you decide to go standard of care, go do your standard of care. Correct.
It's great. Blends well.
You get a free second opinion.
It is free. And it's true. I do get the opportunity to, even though I'm not part of that medical evaluation team, the upfront, it's good. A couple things to understand for people. One, I do get to join in those calls. I mean, I refer patients. I have patients actively, so I understand the whole process. And you've been there. You've seen Immunocine developed. You've been there along the whole time. You've helped them tremendously. I mean, you've been instrumental in the lab aspect and the cell culture aspect. But I think a lot of people have questions about what's it like to travel to Mexico, whether it's for rehealth or Immunocine.
Or any of it. Yeah, what people don't understand is, for instance, a lot of people ask me, I just got a text yesterday, actually. Is it safe for me to go to Mexico? And I was just blown away because it is safe. And what people don't understand is the two locations are Cancun and Cabo San Lucas. So what happened, I think it was about a month ago, 2 months ago, was actually in Guadalajara and Puerto Vallarta. And those areas are, Mexico's huge. Those areas are basically about, you're talking about 2,000-3,000 miles away from what happened. And this is no different than a riot that happens in Minnesota, whatever, Minneapolis, all these different places that have all these issues in the United States. It's really no different. And if you statistically look at Cancun and Cabo, which are number 2 and 3 of safety in Mexico, they are equivalent to traveling to, I was told, Montana and Utah.
No kidding.
Yeah.
Wow.
Respectively. So there isn't really any issues. I love going. I go regularly. Both the places are a complete contrast because Pacific Coast versus the Caribbean, and they're completely different, and they're great places to go to visit. They're great places to work at, as you'll go there regularly, and it's, you work besides work. Then when you have an opportunity, you're on the ocean. It's a great place to ground. It's a great place to do things to connect with yourself that are good for mental health.
There's great intention behind traveling for medical treatment.
Yep.
Plus the Mexican culture is wonderful, and every doctor, every person, whether it be the concierge or the first person you talk to on the phone, they're wonderful. Like, they're there to help. Can we talk about natural killer cells?
100%. One of my favorite cells.
Buzzword. I don't think it's well understood in general medicine. The people who are watching this now probably heard the word like, boost your natural killer cells, but you actually work with them.
Yes.
What does it mean to work with them?
It's started working with them back in 2011 after finding a publication that there was a mouse model that basically eliminated senescence. And
what's that?
Senescence is basically a zombie cell that occupies space in your body. Every single cell in your body has a finite amount of divisions at one juncture. This is called aging. Cells stop to divide.
They just sit there and
occupy space and cause havoc. They make your hair gray.
Okay.
We both have gray hair.
I got some zombies.
we got some zombies there. They actually help with wrinkles.
What do you mean help? They create wrinkles?
They create wrinkles. They can create wrinkles because they're not functioning correctly. They age you. Internally, externally, your skin has senescence. Your internal organs have senescence. Your immune system, which is the most important aspect.
Is it like cellular debris? Or is it more cells that are...
It's a cell that just occupies space, sits there, no longer divides, and wreaks havoc. It's a zombie. Everybody calls it a zombie now because that zombie then can infect other cells, believe it or not, which is crazy. The way it infects other cells is by secreting these specific factors. Every cell in the body communicates, every single one, including... That's why cancer is a problem. Cancer cells have cancer exosomes, cancer communications that communicate to another cell that basically make another cell mutated and problematic and make cells divide and cause issues.
They have a certain language.
They have
And we can interpret that language now.
Yep.
You talked about intercepting exosomes or creating exosomes, which are little packets of information, basically. It's like sending a package. Versus they can secrete hormones and immune markers, which is more like a telephone call.
Yep,
Okay.
exactly. So it's a bad cell, which if you think of fibrosis of the lung, cirrhosis of the liver, it's a senescent cell. And
They're just vestigial, taking up space and just making
making
old.
old things
Yeah.
older and bad.
And then natural killer cells play
Are
what role?
one of the cells that are in charge, one of the immediate responders of elimination of senescence, of elimination of viruses, which go hand in hand with
Oh, yeah.
cancer, and then secondarily to that, mutated cells. So if you look up natural killer cells, the vast majority, I think it's over 1,500 on clinicaltrials.gov. You'll find over 1,500 clinical studies of natural killer cells and cancer.
So this
It's
is
been a
not
big
just
target.
taking something to stimulate. This
No.
is actually preparing and engineering cells in a lab and putting those in somebody's body.
Correct. Yep.
So that's big stuff. This is cellular therapy. Dr.
Yep.
Gonzalez is somebody who actually works with the cells, engineers these cells to do specific things, tests them in the lab to make sure they're doing those things, and then
they're
decides
safe.
if they're suitable and safe for treatment then.
Correct. Yep. Yeah.
So
Yeah.
is this like an anti-aging therapy too?
It's
Or a
we
health span?
we're going with the health span longevity aspect,
Yep.
which simultaneously is like a dual basically attack, because now it's now known that if you eliminate senescence or if you clear senescence, you can also boost the immune system to kill targeted like mutated cells. The immune system can now function the correct way, because when you eliminate something in the body has an innate capacity to regenerate, to heal, to do what it needs to do. So if I eliminate a senescent cell in the immune system, the bone marrow has a signaling cue to say, I need to replace that cell that was eliminated with a fresh young one
In that location?
in that location.
Okay, this is an incredible phenomenon. Please,
Yeah.
please expand upon that.
Yeah, so it's basically if, for instance, if you have senescence in the immune system, which basically senescence is, these cells that are be circulating in the immune system and not functioning correctly. Now, if I take a natural killer cell, and we can take it from you, or now we know we can take it from a really healthy donor and produce this that can kill better, and we'll talk about
And when
killing
you
in
say
just a minute.
you mean the person who wants to go
The
through
person
NK.
wants to go through it and get
Okay.
it. So that's called autologous, from you into you.
Okay.
It's sort of like a precision therapy. So I can take blood from an individual, about half a pint of blood, half a donation of blood, and from there I can start with, which is something that we do, with about 20 million natural killer cells. From 20 million natural killer cells, which if I take it from somebody that's older, those natural killer cells a lot of times, if they're functioning pretty good, will kill at a ratio of 10 to 1.
10 to 1.
Meaning they're gang
That's
members.
like a Spartan. It's like a highly trained Spartan.
Well, no. 10 to 1, I'm saying the reverse. You need
One
10
cell
natural
will-
killer cells.
Oh,
You need
I'm
10
sorry.
natural killer cells to kill one. They're like gang members.
Oh, got it.
When a natural killer cell is effective, young, and does it the right way, it does it 1-to-1,
Okay.
1-to-1 direct, plus it's serial kills, meaning it
Oh, boy.
kill a cell, then go kill another cell, then go kill another cell until it becomes exhausted, and it's done. That's when they're young, they're active, and this is our goal, is to take your NKs that weren't as functional, and we do this by doing testing on them and culture expanding them. So we talked about, let's say I start with 20 million cells. I
Okay,
produce
wait, so I'm 56 years old. Let's say I send you a half a pint of blood. You're going to get about 20 million of my 56-year-old exhausted cells.
Yep.
And you're going to put them in the lab, and then...
I'm going to purify them.
Okay.
I'm going to expand them. I'm going to activate them with a specific technology that we have, and we can produce upwards of 5 billion
Wow.
cells. Yeah.
Do they get tired during the expansion process?
No, we test for that too.
Okay.
So what we do is we have a specific method of growing this, and we'll look at what's called cytotoxicity, the ability of that cell to kill another cell and to target it at what ratio.
What cell target do you use for the kill test?
We're using the easiest one that's pretty much the gold standard is K562.
Okay.
Yeah, and we also do it.
Which
we
is
have
interesting because for our patients, and if you're
Yeah.
a patient and you've gotten this test, we use a natural killer cell function test, and the target is a K562.
K562
So,
cell. Yeah, it's the gold standard right now looking at cancer. But we also have senescent models. So we also have a brain senescent model, which is a microglial senescent model. We have an immunosenescent model, which is some immune cells that are senesced. And then we also have a skin fibroblast senesced cell, because we published a paper in 2022. Yeah, so if you look at this video, what you'll see is these black sort of flat and thicker cells that are just staying there. Some of them are healthy, and the bigger, fatter ones are senesced. They're senescent cells. These are skin fibroblasts that we went through natural replication, meaning growing them out so they get old. Some of them get older quicker. And then the white dots that you'll see floating around, those are NK cells that were put on top.
Wow.
At some juncture, if you look at about the 7 o'clock area from the center, you will see a relatively large cell there, and you'll start to see an aggregate of a couple of natural killer cells, which end up being a big white blob together. And then if you look how they will pierce that senescent cell's membrane. And then if you look at it, give it a little bit of time, and you'll see that senescence starting to roll and being destroyed.
Wow.
Then you'll see a blank area. And then if you look actually to about the 4 o'clock in the bottom corner of that video, you'll see the same thing transpiring. Then if you look up at the 11 o'clock of that particular video, you'll see the same thing transpiring. Eliminating these big cells, and you'll see how these white cells that are NK cells floating around are surveilling the area. Because the crazy thing about the NK cell, it has an inhibitory molecule. What does that mean? It means that it can recognize a target and it can bind to it. And if the cell is not supposed to be killed, which is what people worry about, it won't kill it because that has an inhibitory molecule.
So it has an intelligence.
Correct. Okay. It'll be removed and then it'll go on to the next target.
What do you mean it'll be removed?
It'll basically retract itself.
Got it.
And go on to another target.
And where does that target, that indicator come from? The don't kill me indicator.
It's basically from both the cell and the NK cell.
Oh,
they
so
bind to get everything. Yeah.
Oh, what is it?
It's basically an inhibitory molecule. So the cell has an inhibitory molecule, and it also has a activation molecule on it.
And zombie cells lose that inhibitory molecule.
Zombie cells lose that inhibitory
Let's
molecule.
talk about those zombie cells. So, is there any other way to get rid of zombie cells besides?
One of the simple approaches to stop the advancement of it is to put yourself in autophagy. Okay. Which is basically the easiest way to do it is fasting. Okay. Yep. When you do fasting, it basically forces those. Remember, autophagy is removal of
like self-feeding.
Debris, self-feeding.
Yeah.
And the debris in the context of senescence are these what's called senescent-associated secretory phenotype. It's what's being released by these senescent cells. Autophagy, then, the cells will come and pick that up to feed itself in your body. Okay. When you eliminate that, it stops the progression of senescence. It helps with it.
Like a 5-day fast, a 3-day, or 24-hour intermittent fasting overnight?
You can go into autophagy with just a 24-hour fast.
Yeah, which is what commonly you and I are proponents of 24, sometimes a 36-hour fast. Yep. And so if people do this enough, then it's not just one time. It's part of your internal biohacking or your health span.
It's a regimen.
It's a regimen.
Yeah.
Similar to what you and I have on. We have vests on.
We have vests on. Yes. I love this vest
because
it's my go-to every single morning. This particular one is the compression one with weight. It's the way to go. It's 8 pounds. Compresses when you wear it tight enough, which is great because now it forces you a little bit quicker of rapid breathing. And it's sort of like you're getting a workout while you're working out. It intensifies your workout, which is great for hiking, walking, jogging, all of it. You have a different one.
I have the recovery vest.
This
one, sometimes I wear it when I'm seeing patients or just around or on podcasts. That little bit of weight is just increasing your metabolism. It helps gap your joints. I love it too. But you told me that you run in yours.
I run in this
one. Like a ruck run.
Yep. Yeah. I run in this one, which I love because it makes my run, of course, harder. Yeah. And even when I hike, because I hike a lot, I live up in the hills in California. And when I hike a lot, it gives me a better workout versus not using it. I more than anything else like the compression aspect of it.
Yeah, feels good.
Because I notice it also, you sweat more when you wear this. I'm just wearing this right now, even though I'm wearing a dress shirt underneath. But just, so visuals. Yeah. For visuals, it's funny because when I walk down the street with this, people are like, oh, what kind is that, a military vest?
Yeah. So we should give a shout out because this is the Ion vest. AION gear.com.
Gear.com, yep. Yeah. Great vest. Go out and get yourself one. They have promos on a regular basis. Yeah. Some people are like, oh, they're a little expensive versus other ones. I've tried all these different ones, and there's no comparison. This thing is so comfortable. You can run with it. People do not understand. This is your health. We talk about this all the time. Yeah. Spend that little bit more for something that's quality and,
it's well balanced. Yep. It's comfortable. It's good looking. Yep. It's so functional. It has multiple functions. I agree. It's just good, and it's true. Some people are like, oh, I don't like wearing a weighted vest because I got something that's clunky or uncomfortable, or it has like sharp ridges and it's digging in somewhere.
Not this.
There's not a dig. There's not a problem when you wear the compression vest. And who else makes a vest like this that you can like?
Correct. That's actually a cool vest to wear on a daily basis and stuff. I just wear mine every morning when I work out, or when I go to the gym. Sometimes I'll wear it to work out. I love this vest. The comfort of it.
Can I switch gears?
Yes.
Switch gears. Exosomes. A lot of buzz around exosomes. I'm not an expert in them. You are.
Yeah.
Can you take us through what exosomes are and what's all the buzz? Are they for treatment? The pros, the cons, maybe go through that for a few minutes.
So the exosome is basically a communication vesicle. It's very similar to a cell in the context of it's about 1/1000th the size of a cell. It's a nanoparticle.
Wow.
And it's produced within a cell, and that vesicle is protected, similar to a cell, by a lipid bilayer. The reason why it's protected is its ability to then, when it goes out into space, into the extracellular space, it doesn't get destroyed.
I think of it as like sometimes, like I watch Star Trek, and you have the big mothership, and occasionally like a small little like vessel will go out and explore, and it like spits out of there.
Yep.
That's what I think of when
and does its job.
Yes.
And the job in the context of an exosome can be anything, because every cell in the body communicates. It's one of the methods of communication. Only one of the methods. Multiple methods of communication from one cell to another, and it can transfer a message, which is like messenger RNA, microRNAs. It can transfer a lipid if a cell needs help with
like a
building
carrier
a lipid.
Pigeon in a sense?
It's like a carrier to help other cells or make changes in other cells.
Here's the fascinating question I have. How do the cells know who that message is for? There's billions of cells. There's miles of blood vessels.
Lock and key systems.
Wow.
Which is called a receptor ligand in scientific terms.
So there's great intentionality between what the message is and who the recipient is.
Correct.
So then there's all this buzz about like, oh, I just did exosomes, or I got injected, or my doctor has the best exosomes, or I don't know how to sift through this.
It's hard because everybody's focused on the exosome instead of focusing on the most important aspect, what's the payload? Because I can produce an exosome from every cell in the body does it from cancer.
Oh.
Like, it's one of the ways that cancer communicate. We now know this, and there's testing modalities. They're actually looking at right now, like testing modalities of how to test individuals for these circulating exosomes that possibly have, mutations, oncogenes in them.
They can send signals out.
They can send signals out and cause havoc to other cells, mutate other cells, and be problematic. So you have to look at what's the payload. And a lot of times, people don't understand is, well, I got exosomes. Well, where did you get exosomes from? What was the payload? What was the purpose of you getting exosomes? What is in that exosome? We specifically spent years studying how do we produce an exosome that carries a significant amount of the most abundant proteins in your body, which are collagen 1,3, high molecular weight HA, plus healing and growth factors, healing repair factors. We were able to produce it many years ago, back in 2014, doing some work with a local partner. And we found what we thought is the ideal one. And then as years progress, tweak to the ideal, what we have now, that is dealing a lot with healing, repair, can deal both methods of skin and then also orthopedic. But if you look at what this product contains, the product contains the ability to do quite a bit in, healing and repairing the body. Because, there was there was an article came out about a year and a half ago on how high molecular weight HA led to, in a mouse model, how it led to, in a rat model actually it was, how it led to extension of life, how it led to healing of organs, because people don't understand, you think of hyaluronic acid, high molecular weight is much more important than low molecular weight. Commonly, you'll see out there low molecular weight. This stuff lines not only all your joints, it's one of the key things that's inside the joint, the fluid inside of it, but it also lines the internal organs, the lungs, and everything. And it's a supportive
It's like an
structure.
anchor system.
It's a supportive structure for all of it. The stuff breaks down as you age.
Yeah.
And, supplementing with this or putting this stuff back into you, including collagen 1 and 3, are really, really important, for the body.
Let's get this straight. Your lab actually produces exosomes, scientifically engineered for a specific purpose. You actually know what it's designed to do because you designed it, and you test it to make sure that the exosomes that leave your facility for a clinical trial or for topical use or what have you are engineered very specifically. So I have to, and folks out there, that's the important part, is you can just go get exosomes, but there's got to be some bad players in the world.
There's way too many of them out there. There's a ton of them out there. And I would avoid and find out a lot more details people are getting messed up with some of these, with stuff that's out there, not understanding why they're used. You got companies out there just taking amniotic fluid from somebody and then putting it into somebody else, not understanding that if you take amniotic fluid from a baby, it contains a ton of antibodies, it contains a ton of different proteins, some regenerative factors in there. They're calling them, there's exosomes in there because those are communications things. But what you're not understanding is that these exosomes carry genetic material. And what happens if there's genetic aberrations?
Could get transferred.
In that those things, there's a possibility of these things getting transferred. It can be problematic.
They could maybe become part of that person's genome then?
We don't know at this juncture. We don't know. But for instance, the cells that we use are in clinical studies. The cells that we use are fully genetically tested until they die to make sure there's no aberrations. And when we've taken a lot of these, tissues post-birth and grown them up, you'll be blown away how many mutations will grow in these cells.
I would be blown
and then
away.
you have to discard it. You have to discard it. You spend a lot of money researching it, developing something, and then you just end up discarding it because you can't give that to somebody. And then understanding of how you put the condition that you put the cells in to make them produce what you want.
Yeah.
Every single baby is born differently.
It's not easy. You can't just
easy.
Make an exosome and then go sell it.
Correct. Yeah.
It takes
Correct.
years.
Yeah, because if you just take it, I obtained it from post-birth tissue, amniotic fluid tissue, the umbilical cord, and just ground it up. Every single one of those processes, every baby is completely different. The amount of protein.
They are.
Yeah. Every one of us is unique, completely different. We are not going to have the same amount of protein concentrations. We are not going to have the same amount of growth factors. We're not going to develop the same. We're all going to have our own, problems, etc. This is exactly what you get when you risk using these type of products versus using what we call stable cell culture lines that have been tested and analyzed and looked at.
Yeah, and produce a consistent product.
Which is really important, lot to lot.
So I want to, before we wrap up, we have a present for you. Dr. Graffius is here with us. You grab Dr. Rafael's present. Gracias. So this is a LifeTune Flex. Always on our table here, we have an Aries device. This is a Zone Max, and this is really helping to protect us. Like this whole office is an Aries certified EMF safe zone. And this particular one, this Flex, this is a necklace, much like the one it is the same one that I wear.
Cool. Thank you.
Aries gives us these to give to our guests. And so this one is for
Thank you. Awesome.
I can show you how to put it together when we're done. But that to me is a great all the time biohack.
Correct. Yep.
We have these throughout our office. I have these throughout, I keep them on my person. They're on my phone. But I just want to wrap up by giving a little bit more attention to NK cells because I think they deserve it. I think they're unsung heroes. You are a pioneer in this field. I talk to you. I've probably bugged you weekly over the last year and a half about the cells that you produce, the off-the-shelf ones.
Yep.
When are they ready? I want to get these into patients because I understand their potential. They're not inexpensive, but they're so different than stem cells, and stem cells get all the
Correct.
buzz. But I look at NK cells as, I think, and I've told people who've gone to your clinic in Cancun, like, if you're going for stem cells, first get your NK cells clean up before you reinstitute. I don't know, and tell me if I'm wrong. I just feel like NK cells are kind of where it's at.
1,000%. I think it's the future of, believe it or not, regenerative medicine and immune modulation, which is the most important aspect because we take for granted everything that we're exposed to on a daily basis. The natural killer cell is one of the first responders in a lot of it. And if you boost your immune cells, you basically deal with a little bit of everything. People say, what do you mean a little bit of everything? People that are sick, it affects your skin. You look bad. NK cells eliminate a lot of these viruses, a lot of these issues that we have, a lot of targets that we have that are problematic. Unfortunately, as you get older, the NK cell is no longer a natural killer. I call it basically a dormant office worker or a government worker. I should call it a government worker. Let's say that better.
Boring.
And they don't do much. And they're actually, you can see these when you look at these scientifically because they become just signalers, and they're called these CD56 specific protein that we look at them. They end up being CD56 bright, where you want killers, or CD56 dim cells. And those are the ones that you want to produce. Even though signalers are good, but if they're going to be signalers, you want them to be really good signalers.
Got it.
To do the right thing, meaning signal the right, cytokines that are there to actually target.
You don't want tired warriors who are bored or tired, or they can't wield two swords at one time, so to speak. You want, I love it. I understand. Thank you.
Well,
thank you for being here.
Thank you for having me. I appreciate it.
This has been great.
This
is Dr. Rafael Gonzalez. Just a wonderful and brilliant scientist. Kind of like a clinician, even though he doesn't technically see patients, but he's doing clinical trials out of his lab in California and at ReHealth in Cancun. And of course, we talked about Immunocine, but what we talked about here is really the future of anti-cancer immunology and immunotherapy. This is true cellular therapy. It's not using a drug. It is using your own cells to do what they were supposed to do, but for whatever reason couldn't. And I really hope for the audience out there that that's clear. If not, write in and ask questions. But for this awesome episode, this is Dr. Dan Rubin for Rubin On Point. See you next time.
Thank you for joining us on Rubin On Point, a podcast about cancer, resilience, and most of all, about being human. I hope today's conversation inspired you to see new possibilities for growth, healing, and strength in your life. If you enjoyed this episode, be sure to subscribe, leave a review, and share it with someone who could use a little extra resilience in their day. Remember, no matter what challenges you're facing, resilience isn't just about bouncing back. It's about building a life of purpose, connection, and vitality. Until next time, stay strong, stay healthy, and take care of yourself and those around you.